As a neurologist, I have spent more than 20 years treating patients with memory loss, brain fog, strokes, and various forms of cognitive decline. In that time, I have seen many treatments come and go, some promising, some disappointing. But nothing has disturbed me more than what I recently discovered about one particular supplement that millions of seniors around the world take every day. It is marketed as a natural brain booster, as a gentle helper for memory focus and mental clarity. It is found in pharmacies, health food stores, and even grocery stores. Many of my own patients came to me asking if it was safe to use or if it could prevent dementia. For a long time, I remained neutral, but then I started digging deeper into the science. I reviewed the most recent clinical trials, case reports, and autopsy studies related to this supplement. What I found shocked me. Not only is it often ineffective, but in some cases it can actually increase the risk of damage to the brain's delicate blood vessels, especially when taken without medical supervision. I am talking about the kind of damage that leads to sudden strokes, microbleeds, and long-term brain degeneration. What makes it worse is that many people who take it are also on other medications such as blood thinners, blood pressure pills, or diabetic drugs. The interaction between this supplement and common medications can quietly raise the risk of vessel rupture or brain hemorrhage overnight. This is not speculation. These are documented risks reported in major neurological journals. Yet no one talks about them. You will not hear this in advertisements. You will not see it on the label. And most people who buy it never think twice. As a doctor who works with aging brains every day, I believe it is time to speak honestly about what we know and what we do not. Because your brain is too valuable to be put at risk by a supplement that seems harmless but may do far more harm than good when misused. The supplement in question is ginkgo biloba. This plant has existed for millions of years, and its leaves have been used in traditional Chinese medicine for centuries. In the modern world, ginkgo is extracted into pills, powders, and teas and sold as a brain health supplement. You will find it in nearly every pharmacy in the United States, and countless websites promote it as a natural solution for memory, loss, confusion, and even dementia. The appeal is strong, especially for seniors who fear mental decline and want to preserve their independence. Ginkgo seems to offer hope. It is plant-based, widely available, and marketed as gentle. Many people assume that because it comes from nature, it must be safe. But the truth is more complicated. In reality, the compounds found in ginkgo biloba interact with many systems in the body. The most notable is its ability to thin the blood by reducing platelet aggregation. In theory, this could improve blood flow to the brain and prevent clots. That is why ginkgo was originally researched as a treatment for vascular dementia. But in practice, the effects are not always helpful and may in fact be harmful. Clinical studies have shown that while ginkgo may slightly improve circulation in some patients, it also increases the risk of internal bleeding, especially in older adults. The bleeding may be slow and silent, taking place in the brain without immediate symptoms. Or it could be sudden and severe, leading to stroke, confusion, and even death. The biggest problem is that ginkgo is sold as a dietary supplement, not a regulated medication. That means manufacturers are not required to prove its safety or consistency. Some products contain much higher concentrations than others, and there is no guarantee of quality control. This makes it even harder for doctors to assess the risk for their patients. Worse yet, ginkgo is often taken alongside other medications without anyone checking for interactions. It is promoted as safe for daily use, yet almost no senior is warned about the potential dangers it may pose, especially when combined with common heart or diabetes drugs. To understand why ginkgo biloba can be dangerous for the brain, especially in older adults, we need to look at how it affects the blood. Inside your body, there is a system designed to prevent excessive bleeding. When a blood vessel is injured, platelets come together to form a clot and stop the leak. This process is crucial for survival. But ginkgo contains active compounds known as ginkgolides, which interfere with platelet aggregation. That means your blood may not clot properly when needed. In a healthy young person, this effect might be mild. But in someone over 60 whose blood vessels are already more fragile, the impact is far more serious. The brain is surrounded by countless tiny blood vessels that supply oxygen and nutrients to every region. These vessels are extremely delicate and sensitive to pressure changes. Even a slight increase in blood flow, or a minor weakness in the vessel wall can lead to a rupture. Normally, the body would respond by sealing the break quickly, but if platelet function is suppressed by ginkgo, this natural defense is weakened. What begins as a small internal leak can grow into a hemorrhage. If it occurs during sleep or goes unnoticed, the damage can be irreversible. Worse still, this kind of slow internal bleeding often shows no symptoms until cognitive changes appear weeks or months later. There is also a concern with how ginkgo may affect the blood-brain barrier. This barrier is meant to protect the brain from toxins and foreign substances. Some animal studies suggest that long-term use of ginkgo could increase permeability in this barrier, allowing harmful compounds to enter the brain more easily. While this has not been fully proven in humans, it raises questions about how much we truly know about the long-term neurological impact of ginkgo supplements, especially when taken daily over many years. The very supplement people take to protect their brains may be exposing them to a silent form of injury that grows worse with time and goes unnoticed until it is too late. One of the most overlooked dangers of ginkgo biloba lies in how it interacts with other medications. Seniors are more likely than any other age group to take multiple prescriptions daily for conditions such as high blood pressure, diabetes, high cholesterol, or heart disease. Many of these medications already affect blood clotting or circulation. For example, warfarin aspirin, clopidogrel, and other anticoagulants are commonly prescribed to reduce stroke risk. When ginkgo is taken alongside these drugs, the combined effect can dangerously thin the blood beyond safe levels. This increases the chance of spontaneous bleeding, both in the brain and elsewhere in the body. Even non-prescription supplements can interact with ginkgo. Fish oil, vitamin E, garlic capsules, and turmeric extracts all have mild blood-thinning properties. While these may seem harmless when taken alone, using them with ginkgo can create a compound effect. It is like taking multiple mild thinners that together behave like a strong anticoagulant. For someone with fragile blood vessels, this combination can silently trigger brain bleeds or microclots. The frightening part is that many seniors do not realize these interactions exist. They take ginkgo in the morning, fish oil at lunch, and aspirin before bed, not knowing that their body is gradually becoming less able to stop internal bleeding. Certain medical conditions also magnify the risks. Seniors with a history of stroke or transient ischemic attack are particularly vulnerable. Those with uncontrolled hypertension may already have high pressure in their brain vessels, making them more likely to rupture. People with liver or kidney issues may not process supplements normally, which alters the concentration of active compounds in their blood. All these factors combine to create an unpredictable situation where even a low dose of ginkgo can become dangerous. And because supplements like ginkgo are not regulated as tightly as pharmaceutical drugs, there is no reliable warning system to catch these problems before they happen. One of the biggest challenges in detecting brain vessel damage is that early symptoms are often subtle and easy to dismiss. Many seniors who are experiencing the beginning of a brain bleed or microvascular injury will not feel sharp pain or collapse. Instead, they may notice small changes in how they think, move, or feel. For example, they may suddenly feel more confused or forgetful than usual, even though they had been mentally sharp just days before. They might have trouble finding words, lose track of time, or feel lightheaded for no reason. These are not random signs. They are red flags. Another warning sign is sudden changes in coordination or balance. A senior who normally walks steadily may begin to stumble more often or sway when standing still. Others may feel like the room is spinning even when they are seated. Some may complain of persistent headaches that do not respond to regular painkillers. These headaches may feel different from past ones in terms of location, intensity, or duration. Blurred vision, double vision, or brief episodes of tunnel vision are also clues that the brain is under stress. These symptoms are often brushed off as normal signs of aging or fatigue, but they may point to something far more serious developing inside the brain. What makes this so dangerous is the delay in response. Because these signs are vague, many seniors wait days or weeks before seeking medical attention. During that time, small bleeds or vessel blockages may be progressing silently. By the time imaging is done and damage is found, the injury is harder to treat. That is why recognizing these early symptoms is critical. If you or a loved one is taking ginkgo biloba and begins to show changes in mood, memory, movement, or vision, do not assume it is just aging. Bring it up with a doctor and ask specifically about possible vascular effects of the supplement. There is a particular danger that comes with taking ginkgo biloba in the evening or before bedtime, and it is something many people never consider. During sleep, the body goes through significant physiological changes. Blood pressure typically drops in the early hours of the morning, while heart rate slows and breathing becomes more shallow. For most people, this is a natural process that allows the cardiovascular system to rest. However, for seniors, especially those with fragile arteries or already impaired circulation, this nightly dip in blood pressure can cause the brain to receive less blood flow at the very time it needs repair and oxygen. Now imagine this scenario. A senior takes ginkgo biloba at night hoping to support brain function, but the supplement begins to reduce platelet activity right as blood pressure is falling. If there is even a small weakness in the wall of a cerebral artery, or if there has been previous microdamage, this is the perfect storm. The vessel may leak slowly or burst altogether. Because the person is asleep, they will not feel the warning signs. There is no headache, no vision change, no slurred speech. They simply do not wake up, or they wake up confused, weak, or unable to speak. This is why so many strokes in older adults occur early in the morning and are discovered only after it is too late to reverse the damage. Research in neurology has long recognized the link between early morning hours and the highest incidence of fatal strokes. Part of this is due to natural hormonal shifts, but part of it may also be due to the timing of certain medications or supplements. Taking ginkgo before bed may seem harmless, but it interferes with the body's most vulnerable hours. The brain's small vessels are under reduced pressure, but reduced clotting ability means they cannot seal even the smallest leak. Over time, if this occurs repeatedly, it can contribute to silent brain damage that accumulates and leads to vascular dementia. There are specific groups of seniors who should avoid ginkgo biloba entirely due to their heightened vulnerability. First are those who have a history of stroke or transient ischemic attacks, also known as mini strokes. These individuals already have compromised blood vessels in the brain and are at much higher risk of a second or more severe event. Ginkgo's blood thinning effect can increase the likelihood that a small leak turns into a dangerous bleed. Second are people with bleeding disorders such as hemophilia or thrombocytopenia. For them, even a slight suppression of platelet function can lead to uncontrolled bleeding. Third are those taking medications that affect clotting. These include not just warfarin and aspirin, but also newer anticoagulants like apixaban, rivaroxaban, or dabigatran. If you are on any blood pressure medication, you may already experience nighttime drops in circulation, which makes ginkgo even riskier. Fourth are patients with liver or kidney impairment. These organs help metabolize supplements and medications. When their function is reduced, the active compounds in ginkgo can accumulate and remain in the bloodstream longer than expected, increasing the risk of side effects. Fifth are individuals preparing for surgery. It is standard medical advice to stop all blood-thinning supplements, including ginkgo, at least 1 to 2 weeks before any planned surgery dental procedure, or even minor operations such as cataract removal. That is because ginkgo can make it difficult for the body to stop bleeding during and after surgery. Ignoring this advice has led to emergency situations including internal bleeding and prolonged recovery times. Lastly, any senior who has experienced unusual bruising, nosebleeds, blood in urine, or unexplained fatigue while using ginkgo should stop immediately and consult a doctor. These are potential signs of hidden bleeding. As a neurologist who has treated hundreds of seniors with memory loss, strokes, and cognitive decline, my goal is not to scare you, but to inform you. Supplements like ginkgo biloba are not inherently evil, but they are powerful, and like any powerful substance, they must be treated with caution. Too many people think of supplements as harmless because they are sold over the counter. But the brain is a delicate organ, and the blood vessels that feed it can be easily damaged when we introduce substances without understanding how they work or interact with our medications. The tragedy is that many seniors take ginkgo to protect their brain, not knowing that they may be putting it at greater risk. So what can you do instead if you want to support brain health and protect your memory? First, focus on lifestyle. Get at least 7 hours of quality sleep each night, as this is when the brain clears toxins and resets. Eat a brain-friendly diet rich in leafy greens, berries, omega-3 fatty acids, and whole grains. These provide anti-inflammatory support and nourish blood vessels. Stay mentally engaged by learning new skills, doing puzzles, or reading regularly. Physical activity, even walking 20 minutes a day, improves circulation and oxygen delivery to the brain. And of course, manage your blood pressure, cholesterol, and blood sugar with your doctor's guidance. If you still want to use supplements, there are safer alternatives. Phosphatidylserine is a compound found naturally in the brain and has been shown to support memory in seniors without thinning the blood. Lion's mane mushroom is another promising option with neuroprotective properties. Bacopa monnieri, used in Ayurvedic medicine for centuries, has shown mild benefits for cognitive function in some trials. However, no supplement should replace medical advice. Always talk to your doctor before starting anything new, especially if you are over 60 or taking medications.